For decades, my country, Colombia, has been on the front line of the so called war on drugs. We have paid some of its highest cost and seen firsthand how criminalization and militarized strategies, eradicating coca fields, seizing cocaine, and capturing traffickers have unfortunately failed. They have instead fueled instability, violence, corruption, and pain. Meanwhile, drug use and production continue to rise. It has long been clear that the world needs a different path forward, one that moves beyond punitive approaches and embraces human rights, public health, sustainable development, safety, security, and dignity. Yet no nation can tackle the drug phenomenon alone. By its nature, it transcends borders and sectors that can only be effectively addressed through international cooperation and collaboration. When I was president of Colombia, we called for such a shift, which eventually led to the 2016 United Nations General Assembly Special Session on Drugs. This represented a historic opportunity to rethink global drug policy and generated important moments towards public health and human rights. However, 10 years later, much of the promise of that moment remains unfulfilled. As this report from the International Drug Policy Consortium shows, much of the progress we have seen, expanding harm reduction services, increasing access to essential medicine, and reorienting policies to safeguard human rights and promote sustainable development, has occurred in spite of the global drug control system, rather than because of it. And as we face geopolitical, financial, and environmental instability, this progress is under threat, and in some places has already began to backslide. We must face this moment not with resignation, but with renewed determination. At local, national, regional, and global levels, we must eliminate stigma and discrimination against people who use drugs, small scale farmers, indigenous peoples, and other marginalized communities disproportionately affected by drug policies. We must shift investment and resources away from harmful, costly, punitive responses and towards proven health interventions, including harm reduction services. We must push for the alignment of drug policies with human rights and for a real review of the drug control architecture. This timely report not only highlights how far we still have to go, it points the way toward offering important lessons for government, multilateral institutions, civil society, and communities. 10 years after the UNGASS, challenges remain, but we still have the energy, the tools, and the opportunity to achieve better and more humane drug policies. This hope for a brighter future has guided my work on these issues, first in government and now as a member of the Global Commission on Drug Policy. Together, with determination and resolve, we can make it happen. Thank you.